So today I want to talk about health and healing from a totally new perspective that most people don't really think about. Oh, don't forget also my new book, The Heart of Healing, which you can obtain if you write to info@creatinghealth, info@creatinghealth.co.za. So health and ill health. I mean, the conventional model, and most people think of health and ill health as two separate things. That we have health on the one side and we have ill health on the other side, and that when you become ill, you've got to treat the illness. That's not my perspective at all. Keep in mind that even in a person that is very ill, there is much more health than ill health, much more. I mean, I have a family member who's dying at this moment. I mean, she's been dying for 2 months. And her pH of her blood is still constant. Her temperature is still constant. She's still breathing in and out. She's still digesting her food. There's obviously nutrients getting into every cell as much as the body can do. So although she's dying, the fact is that she is still functioning mostly damn well. Her body's still doing what it needs to do. Can you imagine keeping the temperature constant? It's not a simple thing. It's not just like turning a switch and turning the heat up again. It's not like that. The body has to keep a constant, a very narrow perspective of temperature. And most people's temperature remains around about 37, which is the average. Isn't that amazing? The body can do that under the most horrendous circumstances. People can be riddled with cancer all over the body, and yet temperature remains the same. pH of the blood remains the same. Very, very narrow perspective. Body's still digesting the food and managing to get both oxygen and nutrients to every cell as much as it can. Still maintaining function. A friend of mine, his mother died at the age of 93. For the last year of her life, she wanted to die, and she didn't. She was just lying in bed, and she couldn't function, but her body was still going, maintaining functionality in the most astonishing way. In the end, she decided to stop eating and drinking, and then she died. So the body has astonishing capacities to maintain functionality right through, and keep every single cell, the billions of cells, in the right framework of health. Body's doing that. So when ill health happens, it's not that the body's health doesn't know what to do, that the body health is not maintaining functionality. It's doing the best it can. That ill health is what I call the voice of health asking for help. That's ill health. Ill health is the voice of health asking for help, saying, guys, I'm doing the essentials. I'm keeping the temperature constant. I'm keeping the pH constant. I'm doing the best that I can. But there are stuff going on over here that I can't quite manage. There are just too many toxins. The emotional state is causing chemical turmoils inside this body. I'm doing the best I can. I'm keeping this body still alive. But guys, I need some help here. Something needs to happen. So it's not saying treat the symptoms. It's saying help, health, support. Help me to heal. I can do the healing. I'm the only one that knows how to heal. So help me heal. Not treat the symptoms. I don't want necessary drugs inside me, which is, I'm doing the best I can already. You put a drug in which blocks a biochemical process. Remember that? Beta blockers, serotonin uptake inhibitors, all they're doing is blocking functionalities. The body now has to say, oh, I've got some more problems going on over here. I've got enough toxins. I've got enough emotional states going on here. Now you're putting in some more chemicals interfering with functions. That's what drugs do. They interfere with functions, which creates symptomatic relief. But the body says, that's not exactly what I want. I need stuff that can help me to heal. I need whatever that is. I need certain nutrients. I need certain attitude changes. Those are the things I need so that I can do the healing that needs to happen. But instead, we don't do that. We look for quick ways. We want some quick symptomatic relief. But remember, those symptomatic relief is chemical blocks, which we call drugs, or we call medicines, whatever we want to call them. But remember, and I'm not saying there's no place for them, because a lot depends on how deep you want to go, how holistic you want to go, and how authentic you want to be, and So in what way do you want to actually heal with this process? Do you want to see the depth of it, or you just want to treat it symptomatically? I'm not saying there's anything wrong with symptomatic treatment. Sometimes it's essential. The body can't cope, and it takes time to develop new pathways. And so sometimes symptomatic medicine is appropriate. I'm not against drugs. I'm not saying that one shouldn't do it. But remember what's going on here. The body's health is asking for help. That's what ill health is. It's not a separate disease. It's the best the body can do under the circumstances. And sometimes if the body is still doing its best it can, there are weaknesses in the body that appear, and bacteria can come in and virus can come in. And maybe it's a good idea to deal with those bacteria and viruses to help the body to heal. So it's just a question of perception and how one approaches this whole story. Again, I'm not against the use of an antibiotic when it's, removing the bacteria may be enough for the body to then start to do the healing that's done. And remember, that's what does happen. When you take an antibiotic, the antibiotic doesn't heal the problem. All you're doing is you're removing the bacteria in the body, then can do the healing that it does do. If you cut yourself, it's not the Dettol or whatever you're using that heals you. The Dettol only sterilizes the wound. The body does the healing. Only the intelligence within that system will do the healing. If you get a virus infection, well, how do you treat it? Well, we don't really have really good antivirals. Maybe we do have. Maybe there are a few that you can use. But in the end, it's not killing the virus, which is the most important thing. It's supporting the body's health, supporting the immune system. In fact, most people don't get ill with virus infections. So the body can handle it and deals with it. So when a virus actually is able to penetrate into the body and cause a problem, as it were, well, that probably means that it can mean a number of things, that the body's immune system is actually not able to deal with the virus, or the virus has been invited in to stimulate the body's immune system. How about that one? In fact, I often used to say, when parents used to come to me, what is the best stimulus for my child's immune system? Well, the best stimulus is a virus infection. And I actually believe that all these infectious diseases that children used to get were part of the way developmental process of stimulating the body's immune system. We know we take vaccines and maybe they do stop all these infectious diseases, but then we end up with allergy problems. Every child we see has got an allergy problem. And my feeling is that maybe if we were allowing the children to go through all these infectious diseases, that we wouldn't have as much allergy problems. So nothing's so clear-cut when it comes to ill health and disease. But what I do recognize is that what we need to do in any illness is a call for help from the body's health. Let's support health and see what the body can do under the circumstances. Optimize healing processes, whatever that means, lifestyle changes, nutrients, whatever that means, and maybe sometimes even drugs if the body's really in trouble. But the concept of approach should be different, not treating the disease, but supporting health. Have a good day.